Good morning, students. Today we are going to study about non-communicable diseases. Diseases that are not caused by pathogens and are not infectious are called non-communicable diseases. They may be caused either due to deficiency of certain nutrients in the diet or due to malfunction of certain organs because of old age or problems in metabolism. Non-communicable diseases can be broadly grouped as under nutritional deficiency diseases, allergies, organ malfunction diseases, bites and stings.
Cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases are known as non-communicable diseases. In recent years, these diseases have increased as a result of population aging, urbanization, globalization, and changes in lifestyles, and they've become the great epidemic of our age. Non-communicable diseases can largely be prevented by adopting a healthy lifestyle, but to do so requires more than simply personal determination. For example, when wholesome food is more expensive and less available than junk food. When physical activity is a challenge because the parks and recreation areas are not safe or properly equipped. Or when it's hard to quit smoking or drinking because advertising of these products seems to be all around us. That is why laws and regulations are needed to make the healthy choice the easiest choice. Without these laws and regulations, more and more people will develop a non-communicable disease and need lifelong treatment that could ruin them financially. But there's still time to stop this epidemic from growing, and some countries have already taken action by, for example, reformulating processed foods to make them healthier, informing consumers about the nutrition content of packaged foods, making more fresh foods available, regulating the sale of junk food in schools, as well as providing free drinking water, increasing taxes on tobacco, alcohol, and sugar-sweetened beverages, facilitating access to quit smoking programs, banning tobacco use in enclosed public spaces, and limiting the advertising of cigarettes, alcohol, and junk food. Creating opportunities for physical activity, including creating recreational bicycle paths and promoting the use of public transportation. Governments should ensure access to health services for its population, including access to early detection of disease, diagnosis, medicines, and treatment provided without discrimination and without undue financial hardship. People should be provided with information and support that empowers them to manage their own health, giving them greater control over their health and contributing to the health of their families. This way, all together, we can stop this terrible epidemic from getting worse and enjoy longer, more productive lives.
Nutritional deficiency diseases. Inadequate amount or lack of specific nutrients in the diet causes deficiency diseases. If a person does not eat sufficient quantity of balanced food, she or he is said to be undernourished. At times, a person may consume enough food but it may lack one or more nutrients causing malnutrition. For example, protein energy malnutrition (PEM). Protein energy malnutrition is a condition in young children between 1 and 5 years affected by the deficiency of proteins or carbohydrates and fats or all of these in their diet. It may lead to two diseases, kwashiorkor and marasmus. Kwashiorkor, a diet poor in protein during infancy and childhood, results in a condition called kwashiorkor. It is marked by the following symptoms: stunted growth and mental retardation, bulging eyes, frequent diarrhea, thin stick-like legs, water retention, edema, protruding belly, discoloration of hair. Marasmus. It occurs when children below 1 year do not get adequate amount of proteins and carbohydrates. They show the following symptoms: prominent ribs, dry, thin and wrinkled skin, mental retardation, lean and weak body. Vitamin and mineral deficiency diseases. Vitamins and minerals are needed in very small quantities to ensure proper functioning of various processes. Each vitamin and mineral has a specific function to perform, and their deficiency would lead to deficiency disease. Organ malfunction diseases or degenerative diseases. Certain health issues or diseases occur due to malfunctioning of some body organs such as heart, kidneys, and pancreas as a result of impaired metabolism or improper hormonal secretions. Some common organ malfunction disorders are diabetes, heart and renal problems. Diabetes mellitus is caused by inadequate secretion of insulin by pancreas. Insulin regulates the level of glucose in the blood by helping the liver to convert excess glucose into glycogen and store it. In diabetic patients, the body can neither use sugar nor store it in the liver. As a result, their blood contains extra sugar but other tissues lack it. Major symptoms of diabetes include fatigue, loss of weight, excessive thirst and frequent need to urinate. Diabetes can lead to malfunction of other organs such as kidneys and heart. Diabetes mellitus patients are given insulin injections or medication depending on their condition. There is a tendency for this disease to run in families. It can develop at any age. It can be prevented with 30 minutes of moderate exercise daily and a healthy diet. Heart diseases. Disorders of the heart and blood vessels are directly related to diet and the way of living. A sedentary lifestyle, fat-rich diet leading to weight gain and stress are major causes of heart malfunction such as the following. Coronary heart disease. It occurs when the heart muscles do not get enough oxygen due to a reduction in blood supply following deposits of plaque or atherosclerosis in the coronary heart arteries. It can lead to angina or temporary chest pain. Heart attack. Coronary artery disease (CAD) leads to a heart attack. It occurs when a part of the heart muscle is suddenly deprived of its blood supply due to complete blockage in the artery feeding it. Renal diseases. These occur when the kidneys are unable to efficiently filter waste such as urea, uric acids, water and malfunctioning kidneys need periodic dialysis to remove waste or kidney transplants. Arthritis. It is a disease of the joints. It is of two types: rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is characterized by swelling, pain and stiffness in the joints, especially the middle joints of the fingers, which may get twisted. Osteoarthritis is caused by the breakdown and eventual degeneration of cartilage at the joints due to aging, heredity or injury. It is marked by stiffness and pain in the affected joints such as the hips, knees and spine. Cancer. It is defined as an uncontrolled growth of some abnormal cells in any part of body that invades other normal tissues. A growing mass of cancerous cells is called a malignant tumor. Cancers are generally named after the organ in which they originate. The basic cause of cancer is unknown, but conditions that may lead to it include overexposure to ultraviolet rays of the sun, nuclear radiation, contact with certain chemicals and smoking or chewing tobacco. Allergy. An allergy is an unusual hypersensitivity of body tissue to certain substances. The substances that trigger an allergy are called allergens. They may be certain foods, drugs, cosmetics, dust, pollen grains or perfumes. An allergic reaction can occur when allergens are inhaled or taken into the body through the mouth or direct skin contact. Asthma, eczema and hives are some of the diseases caused by allergic reactions. Bites and stings. Bites and stings of certain animals and insects such as snakes, spiders and canines are a cause of great discomfort. They can result in vector-borne diseases, as you have learned, which need immediate medical treatment. For example, the bite of a poisonous snake can be fatal if not treated promptly. Poisonous snakes contain venom, which affects the nervous or circulatory systems. Fever. Fever itself is not a disease but is indicative of a disease. Fever occurs when a person suffers from a disease or infection. Fever often occurs when there is inflammation or swelling in any part of the body, or when toxins or some foreign bodies enter the bloodstream. The normal temperature of human beings is considered to be 98.4 degrees Fahrenheit or 37 degrees Celsius. When there is a rise in body temperature from the normal value, it is termed as fever. The pulse or heart rate also increases during fever. Rise in body temperature above 105 degrees Fahrenheit or its fall below 96 degrees Fahrenheit are both dangerous.